You've seen probiotics splashed across yogurt labels and touted on supplement bottles, promising a world of health benefits. But what exactly are they? Are they safe? Are there any health concerns? Let's explore in detail in this video. Probiotics are live, friendly bacteria, tiny organisms that can have a big impact. They're designed to help keep your gut healthy and functioning at its best. Think of them as reinforcements for your body's natural defenses. Your body's microbiome is a complex and dynamic mix of both good and bad bacteria, a delicate ecosystem that needs to be carefully maintained. Probiotics work to help tip the balance toward the good, fostering an environment where beneficial bacteria can thrive and keep the harmful ones in check. Most people take probiotics primarily to support digestion and maintain a healthy gut environment. Beyond digestion, there's also growing and exciting research exploring the potential of probiotics for immune support, suggesting they may play a role in strengthening your body's defenses. Some studies even point to benefits for skin health and even mental well-being, exploring the intricate connection between the gut and the brain, often referred to as the gut-brain axis. But remember, anything you add to your body, even something as seemingly beneficial as probiotics, can potentially have effects, and sometimes, though rare, side effects. Can probiotics cause problems? The answer is sometimes yes, but usually just mild, short-lived digestive issues. When you introduce new bacteria, your gut needs time to adjust. You might notice gas, bloating, or mild stomach discomfort at first. These symptoms are a sign your gut is recalibrating, not a reason to panic. For most, these effects fade after a few days or weeks as your microbiome settles. If symptoms are strong or don't go away, the strain or dose may not be right for you. Not all probiotics are the same, and everyone's gut reacts differently. If discomfort persists, stop and consult a healthcare professional. For most people, the initial gurgles are just part of the adjustment. Most side effects are digestive, but some people notice other changes. Increased thirst can happen as your gut's metabolism shifts. Just stay hydrated. Some experience mild headaches, especially if sensitive to amines found in certain probiotic strains. Rarely, you might see skin reactions like a rash or itchiness. This could be an immune response or an allergy to an ingredient. True allergic reactions, like hives or swelling, are rare but serious and need immediate medical attention. Listen to your body. If unusual symptoms persist, stop the probiotic and talk to your doctor. Most less common side effects are mild, but always pay attention to your body's signals. Safety first, especially if symptoms are severe or don't go away. After hearing about potential side effects, you might find yourself wondering, are probiotics actually safe for me? It's a valid question, especially when considering adding something new to your daily routine. For most healthy adults, the answer is yes. Probiotics are generally recognized as safe and are widely used by people around the world. They've become a staple in many households seeking to improve their digestive health. The mild side effects, like temporary gas or bloating, usually go away on their own within a few days as your body adjusts. These beneficial bacteria are already present in many of the foods we eat regularly, and they have a long and well-documented history of safe use in traditional diets across various cultures. The FDA regulates probiotics as dietary supplements, so the quality and effectiveness can vary significantly between brands. It's always best to choose reputable brands that conduct thorough testing. For healthy people, the potential benefits of maintaining a balanced gut microbiome usually outweigh the small risk of experiencing temporary discomfort during the initial adjustment period. Think of it like adding more fiber to your diet. Your body just needs a little time to adapt to the increased fiber intake. Probiotics aren't a magic bullet, but they can be a valuable and helpful addition to an already healthy and balanced lifestyle. However, the safety conversation changes somewhat for individuals with certain underlying health conditions, which we'll delve into in the next segment. For most people, though, probiotics represent a low-risk and potentially beneficial way to support and enhance their overall gut health. While probiotics are safe for most, some people need to be extra careful. Those with weakened immune systems, like people on chemotherapy, with HIV, AIDS, or organ transplants, face rare but serious risks, such as infections. Critically ill patients or those in intensive care should avoid probiotics unless supervised by a doctor. People who've had major surgery, especially involving the gut, should also be cautious. Premature infants are a special case. Probiotics may help in hospitals, but only under strict medical supervision. If you have chronic conditions like Crohn's or ulcerative colitis, talk to your doctor first. For these groups, self-prescribing probiotics isn't safe. Always consult a healthcare professional. Safety comes first for vulnerable populations. Ready to try probiotics? Choosing the right one matters. Don't fall for flashy marketing. Read the label carefully. Look for specific strains listed, like Lactobacillus rhamnosus GG, not just probiotic blend. Health benefits are strain specific, so know what you're getting. Check the dose listed as CFUs and look for potential allergens like dairy, soy, or gluten. Reputable brands will clearly state if they're allergen-free. Look for third-party certifications like NSF or USP for quality assurance. Careful label reading helps you pick a safer, more effective product. The right probiotic is about quality, not just quantity. Make an informed choice for your health. Once you've picked a probiotic that seems right for you, it's time to think about how to introduce it into your system. Remember, this is a journey, not a race. The key is to start slow. Don't jump to the full recommended dose right away. Your gut needs time to adjust to these new inhabitants. Begin with the lower dose, perhaps half or even a quarter of the recommended amount for the first week. This gradual introduction will allow your gut microbiome to adapt and minimize any potential discomfort. Sometimes a different strain of bacteria or a lower dose of the same strain may work better for your unique gut environment. Remember, everyone's gut microbiome is unique, so what works wonders for one person might not be the best fit for you. It's crucial to always consult with your doctor or a qualified healthcare professional before starting any new probiotic regimen. A quick chat with your healthcare provider is the best way to ensure that probiotics are safe and appropriate for you and to help you make informed decisions about your health. Thanks for watching. Please subscribe to the channel Microbe Masters for more insights into microbial sciences.